Hi, here's how to use the enzymatic processor. This is a device for detecting periodontal disease-related organisms to assess patient risk. The device comes as three objects. You'll get the processor itself, you'll get a bottle of test strips, and you'll get a transformer, which ends in a plug like this. To power up the unit, simply place the transformer plug into the opening in the back and turn it on with this switch that you see here on the side. The unit beeps and the light flashes briefly when that happens to confirm that it has in fact been turned on. Now, the processor must be turned on before you put any strips in it. You cannot put a strip in and then turn the processor on afterwards. That upsets the electronics. Now, the strips themselves are contained inside this bottle. The strips are they're dated, but they actually last indefinitely as near as we can tell. We've tested strips at least 7 years after they've been manufactured and they're still perfectly good. The only thing is that you don't want to get them contaminated with moisture. There's a desiccant inside the bottle that helps remove moisture, but don't leave the bottle uncapped any more than is absolutely necessary. So always keep that capped when not in use. Now, to get your samples, we recommend that you take the sample from the deepest pockets of record that the patient may have. If they've got a 6mm pocket, we're really interested in finding out what's growing at 6mm because that's where the most risky organisms will be. The deeper the pocket is, the more anaerobic it is, and more that favors the growth of the most periodontopathic bacteria. So, harvesting the sample, we're not interested in what's here at the CEJ. You really want to get that instrument up into the depth of the pocket, and rather than using a root planing sort of stroke, tip the instrument a little bit away from the tooth so that you're just getting discreetly what's there at the apex of the pocket, not the entire side of the tooth. And then once you have your sample, you apply it to the test strip. Now, there are two pads on the test strip, a lower pad and a sort of pink-colored upper pad. The samples are placed on the lower pad. So you just transfer your sample gently to the strip there. Just kind of slide it gently. You don't want to scrape it too hard because the enzyme covering is actually on the surface of that pad, and if you kind of scrape too hard against it, you'll scrape the enzyme off. So just lightly smear your sample onto the lower test strip. You'll see that it's divided in half, so there's room to put two different samples on there if you want to track what's happening in different pockets on the patient, or if you want to run two patients together at the same on the same test strip, I suppose you could do that too. Once you've applied the sample to the test strip, you moisten the upper pad with just a little bit of distilled water. It must be distilled, and the easiest way to do that is just to take a cotton applicator or a Q-tip, moisten it a bit with the distilled water, and just kind of blot gently. This shouldn't be wet, just damp with the distilled water. Then once the sample has been applied and the upper pad moistened, it's perforated, so you fold the two in half and the two pads will meet, and insert it into one of the strips. Once you've inserted it all the way, you'll see this light begin to flash. That signifies that it's coming up to operating temperature. The two strips are independent of each other. You can place one sample strip in here and one in here at different times, and they will be independently heated and timed. So we're just waiting now for this to come up to operating temperature. It should take, maybe a minute or so. So while it's doing that, this flashes. When the light comes to a steady light that is no longer flashing, it's achieved the operating temperature of 55 degrees centigrade, and we'll start the timing cycle of 5 minutes. At the end of 5 minutes, the light will again begin to flash and a beep will sound on the unit to tell you that it is finished processing. So, no light means nothing is inserted in there. Once you insert a strip into the slot, it begins flashing as the heating occurs to get it up to operating temperature. Once it achieves that temperature, the light comes on solid. It'll stay solid for 5 minutes, and then it'll begin to flash again along with a chime or beep from the unit to let you know that your sample is ready for inspecting. To do that, you pull the sample strip out, take and discard the lower half. It's no longer of any use. The actual reaction is going to occur on the upper half of the strip. And there is a a scale printed on the label of the bottle that gives you a rough idea. But it's very simple, really. It's going to turn bluish in proportion to the number of organisms that are present. Now, the test is sensitive to 3 organisms, the 3 most periodontopathic organisms in the literature: Porphyromonas gingivalis, Tannerella forsythius, and Treponema denicola, one of the spirochetes. If any of those organisms are present in numbers approaching 1,000 individual organisms, you'll start seeing faint bluish tinges on there. The deeper the color, the greater the number of organisms. So you can do a differential risk analysis based on the depth of the color. So as it gets more and more a deeper shade of blue, the more organisms are present. If it's covered completely by blue, that would also be another indication that those organisms are numerous in the pocket if the entire sample area is covered with blue. If it's just a couple little spots here and there of blue, those are discrete colonies of them. This is archival, by the way. You can keep this in the patient's record. Simply take a piece of adhesive tape, Scotch tape, place it over the sample, and then you can staple this right in your patient's record. The color won't change over time. And that's it. The BANAzyme processor for periodontal risk assessment.